Hello everyone, I am Dr. Ghanee. I am an oral pathologist. I see patients with oral lesions, and in these videos I share those interesting cases with you so you get familiar with common lesions of oral cavity and also cancer and precancer. Today I want to talk about mucocele or mucus duct cyst. I'm sure all of you have seen this. Usually is on lower lip. It's a dome shape cyst that it seems it's like a balloon structure, and it's under the surface mucosa. Why we develop these cysts? Usually after trauma. We have lots of minor salivary glands that they make saliva and they pour saliva into the oral cavity. They have very small ducts. So with trauma and damage to those glands and associated ducts, saliva cannot be poured in the oral cavity, so we have accumulation of it under the surface mucosa, and that's how a mucocele is being formed. If we don't do anything, a lot of them, they just rupture and they go away, but if they are persistent, usually we remove them. When I remove mucoceles, I numb that area, I do a small incision, and then with kind of shaving the tissue around it, it shows up. It's like really looks like a balloon. It comes up, and finally we get to this part that the cyst is totally exposed. When we remove the cyst, we should look at the bed of surgery site and harvest some of those minor salivary glands that are there and remove them, because those are damaged glands, and if we don't remove them, the mucocele will come back and we're going to have recurrent mucocele. So for example, in this case, you can see after removal of the mucocele, these are associated minor glands. And sometimes these minor glands are attached to the mucocele and the whole thing comes out as one piece. This is a different case that, again, you can see a mucocele right here, and I removed it, and this is after surgery, after I put sutures and stitches. And this is the microscopic view of it. So this is the mucocele, and when I removed it, associated glands came with it, and under the microscope you can see it. This is surface mucosa, this is the mucocele, this is loose connective tissue, and these are associated glands. So sometimes as one piece the whole thing comes out during surgery. I hope you like this video, and I thank you for listening.